Hi, my name's Haley. I'm going to be going through your diagnostic test that we're going to be having done today. So the first one is a bronchoscopy. And what they're going to do is they're going to insert a bronchoscope down through your mouth, down to your esophagus, through your trachea. They're going to be looking at your right lung, your left lung, and your left bronchioles. That's just kind of an idea of what they'll be seeing when they go in. Typically for this procedure, you will not eat or drink anything for 6 hours prior to surgery. Medications that must be taken can be taken with a sip of water 2 hours before surgery or procedure. This test just allows the doctors to look at everything in the lungs, make sure they're functioning properly. If there are anything abnormalities, they can then go ahead and do further testing. Post-procedure, you should expect to feel mouth dryness, have a sore throat. Your voice might be kind of hoarse for a few days. That's normal. You can gargle with warm salt water, or you could suck on a throat lozenge to help with soothe the sore throat. Right after your procedure, the nurse, while you're in recovery, will be checking for changes in breathing. If you have any chest pain, we need to know about that. We'll be monitoring your oxygen levels just to make sure your O2 is maintaining. We're going to wait about 2 hours after the procedure for you to sit up, just so that way we know the sedation has worn off and you are feeling okay. Alright, the next one is a barium enema. And so what this test is going to do is it's going to just show us anything that's going on in the colon. We're going to give you an enema for surgery, during the surgery. Well, not surgery, procedure, and you're going to be laying on a table on your side, on your left side, and we're going to place this enema into your rectum. As the solution flows in, we'll have you try to hold it in, and then it'll just give a really clear picture of the colon so we can detect any abnormalities. And I do have a picture here. So 24 hours prior, you'll start taking laxatives, and then we'll make sure to insert the enema properly. It'll be a mixture of barium, sulfate, and water that'll fill your colon, and then we'll wait for about 15-20 minutes for the solution to get into your body, and then that'll help us get a clearer picture. I have one here to show you how it'll look, but it'll give us a clear picture. So to prep for this surgery, we want you to, you're going to be on a clear liquid diet the day prior, only consuming like clear liquids. So if you drink coffee, no creamer. If you drink tea, no creamer. Water is good. We usually encourage broth or clear carbonated beverages such as ginger ale. Typically after midnight, we won't have you eat or drink anything, and you will also take a laxative either the night before or a few hours prior to the procedure to completely make sure your colon is flushed out. So then I'll show you so after surgery or during your procedure, this is what the x-ray will come up. You can see that it's all highlighted, and then we have a really good image of if there were an abnormality, where it could be, and then we could pinpoint which location it is and get more testing if needed. So for post-procedure, we'll get you to the restroom if you need it to expel any of the additional barium that didn't come out after the enema was done. If you had any abdominal cramping, usually that typically subsides after the procedure is done. You can return to a normal diet and activities right away. There's no restrictions. We do encourage extra fluids because getting an enema can cause constipation. So if you do have any issues, you need to let us know. We can ask the doctor to get you a laxative ordered. Don't be alarmed if your stools are white. It is very common a few days after procedure to have white stools due to the barium still expelling itself from your body. Okay, and the last one is the liver biopsy. And this is just a procedure for the doctor to get a sample of your liver just to help determine if there's any diseases, if we're monitoring a disease, or if we want to check the severity of a disease that may be done. So for pre-procedure, you can eat a very light breakfast. We recommend just some toast, coffee or tea. We ask that you don't take any medications that can increase the risk of bleeding, such as aspirin, ibuprofen, any blood thinning medications such as an anticoagulant. So during the procedure, you'll be awake, and what we're gonna have you do is we're gonna have you lay on your back. You're gonna have your right arm above your head, and we're going to numb the area where the needle will be inserted after the doctor locates your liver. Then once the area has been numbed, the doctor will have you take in a deep breath. He'll insert the needle, get his sample, pull it out, and that'll be it. It's pretty easy. So for post-procedure though, we are going to monitor you for a few hours just to make sure your blood pressure, your pulse, and your breathing are all stable. So we typically have you rest for about 2 hours. You may experience some soreness where the needle was inserted. That can last up to about a week. We do ask that you bring someone with you. We don't want you driving just because of the sedatives and any medications that we give you to help relax you, just so that way we don't have any car accidents or anything. We do ask that you don't lift anything over 10 or 15 pounds for at least a week, and after a week you can return to your normal activities. So here's a picture of how they're going to insert the needle. So you see we're going to have your arm up, you're going to be laying back slightly, you're going to locate that liver, and then it's really close to your lungs, so that's why we need you to hold still, and that's why the doctor's going to go in, get the sample, pull it out, and we'll get you down to recovery. Alright, if you have any questions, let me know. Thanks. Have a great day.